Imagine a US healthcare system in which you played an active role in purchasing and consuming the services you receive. You're knowledgeable and empowered about your care, not leaving the decisions up to insurance and the professionals alone. Why is this such a stretch? Every other purchase you make, from groceries to cell phones, electronics, or even automobile insurance, you're able to view the merchant's website or call the store to learn the cost for the item. Yet one of the most expensive items, our healthcare, is almost impossible to shop for. Many have been accustomed to the idea that healthcare cannot be purchased the way we buy any other products or services, meaning shopping prices online, understanding quality, and comparing reviews. The focus is placed on the cost of insurance instead of the price of care. You can change that, but you have to know what questions to ask. Become educated, engaged, empowered, effective. Patients who are taking control of information, of costs, of their care. Patients who are saying, you know what? I know what I've always done, but I'm going to look for more information. I'm going to define my outcomes. The first thing you need to know is that prices can vary widely for the same services in the same community. There can be over 1,000% difference in the cost of care, depending on where you choose to receive treatment. There are similar variances in the quality of care you receive based on the type of procedure, even at the same facility. For example, an MRI can cost as little as $500 at one facility, and 1 mile away, it can cost as much as $5,000 for the same MRI. It's also helpful to understand that unlike most other consumer products or services in healthcare, quality does not always correlate with higher prices. In fact, statistics for physicians and facilities across the US confirm the quality of care is often the same or better at providers with lower costs. To make better healthcare decisions, we need better information and more transparency from healthcare providers. On average, Americans will spend 2 hours researching the purchase of a new television and 15 minutes researching a healthcare decision. As stated earlier, one of the reasons for this is because the information needed to make informed healthcare decisions can be difficult to find. However, we have best-in-class transparency tools and a dedicated team of care advocates to help members find high-quality care at the best price. You have a choice in your healthcare decisions. When you realize that you can be an active participant in your healthcare and not just a bystander, you can become empowered to ask more questions. And with the right tools, resources, and support, you can effectively take the right steps to ensure you receive the right care at the right time for the right price, and making decisions that are best for you and your family, not the hospital's shareholders. The reality is, the secret to spending less on healthcare is spending less on healthcare. As you become familiar with these resources and begin to shop for fairly priced, higher quality medical care, you will spend less on healthcare. You will quickly observe the savings for you and your covered dependents. Plus, as you become a smart shopper, you are also reducing costs for your health plan, saving money for future expenses, and managing future premium expenses for you and your coworkers. Know your health data, review care options, identify cost and quality information, and make healthcare better, one patient at a time.